In 1847, Dr. Ignaz Semmelweis discovered that childbed fever can be drastically reduced by hand disinfection. In 1853, Florence Nightingale implemented hand-washing practices during the Crimean War. So we've known for a very long time that hand hygiene is the most important practice for preventing the transmission of microorganisms and directly contributes to patient safety. Hand hygiene. It's a universal indicator of safe and effective infection prevention and control practices. Patients expect and depend on us to do it. It demonstrates that you care about and respect them. We can't always see the direct consequences of not performing hand hygiene, like we can see the consequences of a wrong medication given or a wrong site surgery, because germs are invisible to the naked eye and infections take time to develop. This makes it harder for people to understand the role they play in the spread of pathogens. It's for these reasons that healthcare facilities and you are held accountable to hand hygiene performance and healthcare-associated infection reduction. You may not realize all the ways your facility is held accountable, but here are a few of them. The Centers for Disease Control and Prevention and the World Health Organization guidelines tell us how and when to perform hand hygiene. The Joint Commission sets minimum standards for healthcare facilities and holds them accountable for following the CDC and WHO guidelines. It also requires hospitals to determine baseline hand hygiene compliance, set goals for improvement, and demonstrate improvement. They will ask to see evidence of this during their survey visit and will observe hand hygiene during the survey. In addition, the Centers for Medicare and Medicaid Services also holds healthcare facilities accountable to infection prevention and hand hygiene standards. CMS can withhold reimbursement to hospitals and other healthcare facilities based on their rates of healthcare-associated infections. CMS looks at all hospitals' performance, and those that are in the worst performing group receive a 1% payment reduction in their reimbursement. This can equate to millions and millions of dollars each year. There are other patient safety organizations like the Leapfrog Group that are placing pressure on healthcare facilities to perform better by publicly reporting their outcomes for the general public to see. All of this is why healthcare leadership is so focused on improving hand hygiene and reducing HAI. And because it's important to healthcare leadership, you are hearing about it. You play such an important role in infection prevention in your facility. You might say it's the doctors that don't wash their hands, or it's the families and visitors. Sometimes they don't, you're right. But the majority of patient and resident touches in a healthcare facility are from frontline nurses and nursing assistants. All of us have been or will be a patient in a healthcare facility or have a loved one there at some point in our life. We would want to receive or have our loved one receive the very best care. That's why every interaction should start with hand hygiene, and every single one of us plays an important role.